Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. With me today is Dr. Bryn Henderson, and we're going to be talking about breathing, something we all do without thinking, but it can become a struggle for millions of people around the world. Every breath is a conscious effort. Today, we're going to be talking about chronic obstructive pulmonary disease, or it's known as COPD. You may never have heard this before, and your ears are going, what? Chronic obstructive pulmonary disease. It's a condition that is often misunderstood, frequently underdiagnosed, and yet I can tell you, say 20, 25 patients I see in a day, a third of them have some form of COPD. So we want to educate you today. Maybe you don't have it, but maybe a grandparent or your mother or your father, an aunt and uncle. And it would be nice for you to learn about it. If you have it, you might want to know why you have it and how you can help yourself. So today's episode, we're going to dive into COPD, why it happens, how we can better support those living with it, from early signs to breakthrough treatments, and we'll uncover the science behind the symptoms and hope behind the headlines. So let's get to it. What is COPD? What is chronic obstructive pulmonary disease?
Well, I like your lines. Hope behind the headlines. I'll tell you, there's a lot you can do to help patients with COPD. And I'm pretty sure most people know this, but the worst pain in medicine is probably air hunger. You may think it's the blockage of a tube, a gallstone, or an ectopic pregnancy, but the worst pain I've ever seen has to do with air hunger. So patients often feel like they can't catch their breath, and so they shallow breathe and they hurt when they breathe. They may cough a lot. They need to bring up that mucus and phlegm and get the gunk out, but it includes conditions like emphysema and chronic bronchitis, and many times asthma. It's not something only smokers get. The smokers, of course, have difficulty blowing out, so it's obstructive. There's only two pieces to breathing. One's taking a breath in, and one's breathing out. And then when you have variances in what's normal, the out becomes obstruction. And that's why it's such a huge issue. People who grew up in areas with a lot of pollution, like in the coal mines and things like that. Or how about on the farms I did in the Midwest, and they had crop dusters, and they'd spray that stuff, and people would be coughing for days. Or even patients whose lungs didn't develop because as babies they were exposed, or they had a genetic condition that can make someone more likely to develop COPD, and they never smoked.
And we have to include marijuana smoking here. I know a lot of people, they used to say, you can't get lung cancer from smoking marijuana, but you're smoking.
Tears up your lungs.
Yeah.
And vaping's even worse.
Oh, yeah.
25% of the people with COPD have never smoked. Things like low birth weight, premature birth, and even repeated lung infections during childhood affect how the lungs grow. And this can raise risk in later life.
All right. So now you got a person that's fairly healthy. What's the first thing that happens with chronic obstructive pulmonary disease?
Cough. Most people start with a chronic cough.
So they come in and they go, Doc, I've had a cough for 3 weeks.
Well, you're lucky if they come in. Usually their wife comes in or their spouse comes in and they say, every morning I wake up and this clown's cough, especially morning because they're trying to get that mucus up and getting out the gunk. See, the first thing that ever happens when you have COPD is the tissues have cells on the wall and they swell, and to protect the wall, they secrete. And that secretion becomes a mucus plug or congestion in the lungs. And that's why you have shortness of breath, even walking across a room or going downstairs. It gets worse. You can hear them wheeze. What is the wheeze? The wheeze is the spasm of the muscle in the alveoli full of gunk, mucus, sputum, and they pull down on that muscle and there's a spasm in the muscles above the alveoli, and we hear it.
All right. So how do doctors confirm COPD?
A spirometer that has a prolonged expiration, prolonged breathing going out. The spirometry has become the gold standard of diagnosing it because it's so easy to pick up and it's cheap. You can buy a spirometer and use it in your office for $100-200.
What about chest x-rays?
Chest x-ray give you radiation, so you sure don't start that. But you can. I've seen people do two other facets. When I was on medical missions, one of them did thermograms to see about the perfusion, and the other one did what they call oxygen displacement.
So in COPD patients, if you put the oximeter on a patient's finger, what number do you get scared?
Anything below 94% is something you better watch. And anytime you're getting into the 80s, you better have some O2 ready. We did that often in emergency rooms I worked in. But the beauty of that, now that's not even a $50 test. You get both the pulse and you get the saturation, how much oxygen. You can do that on somebody you love or at somebody's home. It's very inexpensive to have that.
All right. So the typical patient that I see with COPD would be somebody who smoked 3 packs of cigarettes a day for 40 years, drank alcohol, and didn't take care of their health. And now they do live into their 80s, believe it or not. It's not a kind of disease where you drop dead. You live with it. When do you put them on oxygen?
Most authorities think below 94 to 93, I think you better have it handy. But you're going to find a lot of variance in their capabilities. Remember, you don't have just oxygen, you have oxygen reserve. That reserve is 20 to 30% of your lung. So if you don't exercise, you have less and less of a reserve.
Well, that's a good reason to exercise.
Amen.
For those of us who don't like exercise, you just scared me.
Well, you might expand that reserve.
You scared me into exercising now.
Good.
All right. So let's do a case study, something that you've done in a patient's journey from COPD to better health.
Well, we have an 80-year-old patient, and she had a long history of COPD, asthma, and kidney problems. And over the past year, she struggled with shortness of breath, insomnia, because she couldn't sleep well, because she couldn't get enough oxygen, and memory issues, because O2 wasn't getting into the brain and helping her think. In fact, that is called brain fog. We use inhalers, oxygen therapy, and a device called an air physio to help her lungs.
What is air physio?
Air physio is a cleanser. It's not a medication. And that helps the exchange of oxygen.
Is it like a breathing treatment?
Yeah, it is absolutely an inhaler. What's amazing is that if you use it regularly with the IVs, you can improve their breathing capacity. We've done it, as happened with this patient, from 32 to almost 50%.
Wow, that is impressive. So your protocol in your office works.
Absolutely. I don't like to do it if it doesn't work.
Yeah.
She used her breathing devices at least 3 times a day and every day stayed active with gentle exercises. And we called her on purpose to give her hope and encourage her to do a little more. Often walking, we'd say, go an extra house a day. So if you're going to walk the neighborhood, walk whatever you're used to walking, 1 more house a day.
All right, so let's review our mnemonic called BREATHE. B is for
Bronchodilators.
R.
For routine checkups.
E
is exercise as tolerated.
A.
Avoid smoke and pollution.
T.
Take medications on time.
H.
Healthy diet and hydration.
And E.
Educate yourself.
And we hope today that you did learn something. I know I did. I forgot about the 20% of reserve air that needs to be stirred up in our bodies. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, Go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pensanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.